A base deficit of -4 in a patient with hemorrhagic shock indicates which type of shock? A. Class 3. B. Class 4. C. Class 2. D. Class 1. Which one of the following is the recommended method for initially treating frostbite? A. Vasodilators. B. Anticoagulants. C. Warm, 40 degrees Celsius, water. D. Padding and elevation. Which one of the following physical findings suggests a cause of hypotension other than spinal cord injury? A. Priapism. B. Bradycardia. C. Diaphragmatic breathing. Regarding shock in the child, which of the following is false? A. Vital signs are age-related. B. Children have greater physiologic reserves than adults. C. The absolute volume of blood loss required to produce shock is the same as in adults. The primary indication for transferring a patient to a higher-level trauma center is A. Unavailability of a surgeon or operating room staff. B. Multiple system injuries, including severe head injury. C. Resource limitations as determined by the transferring doctor. Absence of breath sounds and dullness to percussion over the left hemothorax are findings best explained by A. Left hemothorax. B. Cardiac contusion. C. Left simple pneumothorax. D. Left diaphragmatic rupture. Which of the following statements regarding injury to the central nervous system in children is true? A. Children suffer spinal cord injury without X-ray abnormality more commonly than adults. B. An infant with a traumatic brain injury may become hypotensive from cerebral edema. "27 patients are seriously injured in an aircraft accident at a local airport. The basic principle of triage should be to A. Treat the most severely injured patients first. B. Produce the greatest number of survivors based on available resources. To establish a diagnosis of shock. A. Systolic blood pressure must be below 90 mm of mercury. B. The presence of a closed head injury should be excluded. C. Acidosis should be present by arterial blood gas analysis. D. Clinical evidence of inadequate organ perfusion must be present. A contraindication to nasogastric intubation is the presence of A. Gastric perforation. B. Diaphragmatic rupture. C. Open depressed skull fracture. D. Fracture of the cervical spine. Immediate chest tube insertion is indicated for which of the following conditions? A. Pneumothorax. B. Pneumomediastinum. C. Massive hemothorax. D. Diaphragmatic rupture. Cardiac tamponade after trauma. A. Is seldom life-threatening. B. Can be excluded by an upright AP chest X-ray. C. Can be confused with a tension pneumothorax. D. Causes of fall in systolic pressure of greater than 15 millimeters of mercury with expiration. Which one of the following statements is false concerning Rh isoimmunization in the pregnant trauma patient? A. It occurs in blunt or penetrating abdominal trauma. B. Minor degrees of feto-maternal hemorrhage produce it. C. A negative Kleihauer-Betke test excludes Rh isoimmunization. All of the following signs on the chest X-ray of a blunt injury victim may suggest aortic rupture except A. Mediastinal emphysema. B. Presence of a pleural cap. C. Obliteration of the aortic knob. D. Deviation of the trachea to the right. Early central venous pressure monitoring during fluid resuscitation in the emergency department has the greatest utility in A. Patient with a splenic laceration. B. Patient with an inhalation injury. C. 6-year-old child with a pelvic fracture. A cross-table lateral X-ray of the cervical spine. A. Must precede endotracheal intubation. B. Excludes serious cervical spine injury. C. Is an essential part of the primary survey. D. Is unacceptable unless 7 cervical vertebrae and the C7 to T1 relationship are visualized. Which one of the following statements regarding patients with thoracic spine injuries is true? A. Log rolling may be destabilizing to fractures from T12 to L1. B. Adequate immobilization can be accomplished with the scoop stretcher. C. Spinal cord injury below T10 usually spares bowel and bladder function. During resuscitation, which one of the following is the most reliable as a guide to volume replacement? A. Heart rate. B. Hematocrit. C. Blood pressure. D. Urinary output. A 24-year-old woman passenger in an automobile strikes the windscreen with her face during a head-on collision. In the emergency department, she is talking and has marked facial edema and crepitus. The highest priority should be given to A. Lateral spine X-ray. B. Upper airway protection. C. Carotid pulse assessment. The response to catecholamines in an injured, hypovolemic pregnant woman can be expected to result in A. Placental abruption. B. Fetal hypoxia and distress. C. Fetal maternal dysrhythmia. D. Improved uterine blood flow. A 6-year-old boy walking across the street is struck by the front bumper of a sports utility vehicle traveling at 32 kilometers per hour, 20 miles per hour. Which one of the following statements is true? A. A flail chest is probable. B. A symptomatic cardiac contusion is expected. C. A pulmonary contusion may be present in the absence of rib fractures. The following are contraindications for tetanus toxoid administration. A. History of neurological reaction or severe hypersensitivity to the product. B. Local side effects. C. Muscular spasms. Which one of the following statements regarding abdominal trauma in the pregnant patient is true? A. The fetus is in jeopardy only with major abdominal trauma. B. Leakage of amniotic fluid is an indication for hospital admission. C. Indications for peritoneal lavage are different from those in the non-pregnant patient. All of the following are indicators of inhalation injury, except A. Singeing of the eyebrows and nasal vibrissae. B. Carboxyhemoglobin level greater than 4%. C. Carbon deposits in the mouth or nose, and carbonaceous sputum. During the third trimester of pregnancy, all of the following changes occur normally, except A. Decrease in PaCO2. B. Decrease in leukocyte count. C. Reduced gastric emptying rate. D. Diminished residual lung volume. In managing a head-injured patient, the most important initial step is to A. Secure the airway. B. Obtain C-spine film. C. Support the circulation. D. Control scalp hemorrhage. A previously healthy, 70 kilograms, 154-pound man suffers an estimated acute blood loss of 2 liters. Which one of the following statements applies to this patient? A. His pulse pressure will be widened. B. His urinary output will be at the lower limits of normal. C. His systolic blood pressure will be decreased with a narrowed pulse pressure. The physiologic hypervolemia of pregnancy has clinical significance in the management of the severely injured, gravid woman by A. Reducing the need for blood transfusion. B. Increasing the risk of pulmonary edema. C. Increasing the volume of blood loss to produce maternal hypotension. The first maneuver to improve oxygenation after chest injury is A. Intubate the patient. B. Assess arterial blood gases. C. Administer supplemental oxygen. D. Ascertain the need for a chest tube. Which one of the following findings in an adult should prompt immediate management during the primary survey? A. Distended abdomen. B. Glasgow Coma Scale score of 11. C. Temperature of 36.5 degrees Celsius, 97.8 degrees Fahrenheit. D. Respiratory rate of 40 breaths per minute. When applying the rule of nines to infants. A. It is not reliable. B. The body is proportionally larger in infants than in adults. C. The head is proportionally larger in infants than in adults. D. The legs are proportionally larger in infants than in adults. The following are the criteria for transfer to a burn center, except A. Partial thickness and full thickness burns on greater than 10% of the BSA. B. Any full thickness burn. C. Elevated central venous pressure. Systolic blood pressure starts to decrease in which class of hemorrhage? A. Class 0. B. Class 1. C. Class 2. D. Class 3. For the patient with severe traumatic brain injury, profound hypocarbia should be avoided to prevent A. Respiratory alkalosis, B. Metabolic acidosis, C. Cerebral vasoconstriction with diminished perfusion, D. Neurogenic pulmonary edema. Hemorrhage of 20% of the patient's blood volume is associated usually with A. Oliguria, B. Confusion, C. Hypotension, D. Tachycardia. Which one of the following statements concerning intraosseous infusion is true? A. Only crystalloid solutions may be safely infused through the needle. B. Intraosseous infusion is the preferred route for volume resuscitation in small children. The most important, immediate step in the management of an open pneumothorax is A. Endotracheal intubation, B. Operation to close the wound, C. Placing a chest tube through the chest wound, D. Placement of an occlusive dressing over the wound. Which one of the following situations requires Rh immunoglobulin administration to an injured woman? A. Negative pregnancy test, Rh negative, and torso trauma. B. Positive pregnancy test, Rh positive, and has torso trauma. C. Positive pregnancy test, Rh negative, and has torso trauma. All of the following are true of the Malampati classification, except A. Class 4 is the easiest intubation, while Class 1 is the most difficult. B. It helps assess for difficult intubations. C. It is part of the Lemon assessment. Signs and symptoms of airway compromise include all of the following, except A. Change in voice, B. Stridor, C. Decreased pulse pressure, D. Dyspnea and agitation. Cardiac tamponade. A. Is definitively managed by needle pericardiocentesis. B. Is most common with blunt thoracic trauma and anterior rib fractures. C. Requires surgical intervention. The most specific to evaluate for injuries of solid abdominal organs is A. Abdominal X-rays, B. Abdominal ultrasonography, C. Diagnostic peritoneal lavage, D. CT of abdomen and pelvis. A 40-year-old obese patient with a Glasgow Coma Scale score of 8 requires a CT scan. Before transferring to the scanner, you should A. Give more sedative drugs, B. Insert a multilumen esophageal airway, C. Insert a definitive airway. The most important consequence of inadequate organ perfusion is A. Multiple organ failure, B. Decreased base deficit, C. Acute glomerulonephritis, D. Increased cellular adenosine triphosphate (ATP) production. Hypertension following a head injury. A. Should be treated to reduce intracranial pressure. B. May indicate imminent herniation from critically high intracranial pressure. C. Indicates pre-existing hypertension. D. Mandates prompt administration of mannitol. Initial treatment of frostbite injuries involves A. Application of dry heat. B. Rapid rewarming of the body part in circulating warm water. C. Debridement of hemorrhagic blisters. D. Early amputation to prevent septic complications. Which one of the following statements is true regarding a pregnant patient who presents following blunt trauma? A. Early gastric decompression is important. B. A hemoglobin level of 10 gdl, hematocrit 30, indicates recent blood loss. C. The central venous pressure response to volume resuscitation is blunted in pregnant patients. Which of the following signs is the least reliable for diagnosing esophageal intubation? A. Symmetrical chest wall movement. B. Chest X-ray demonstrating the ETT tip positioned above the carina. C. Bilateral breath sounds.